XNB382, Principles of Exercise Prescription, an initial client screening and consultation by Kaileigh Mapson. The purpose behind exercise pre-screening is to determine and assess risks, understand medical history, and to determine the need for medical clearance or medical supervision. Topics included today are new client screening process, guidelines for exercise testing, informed consent, current activity level, and initial client consultation. The client is a softball player playing the position of catcher for this season. The client is a 23-year-old female with a weight of 74.6 kilograms, a height of 172.4 centimeters, and a BMI of 25.12 in the normal range. Her blood pressure is 110/70, which is a little lower but still in the normal range. The client is feeling a decreased strength and fitness in comparison to last year's season and wishes to be given exercises and an action plan to meet her goals. The client has a history of a torn L4 to L5 disc that happened in March 2014, and the last MRI showed that there were no other complications and the doctors cleared her for physical activity and exercise. The ESSA pre-screening tool is used to determine if an individual is at a heightened risk of adverse event during physical activity or exercise. The client has answered no to all 7 questions in stage 1 of the ESSA form, and through this form we determine the client is moderately active 5 or more times a week, no family history of heart disease, non-smoker, no high blood pressure, no hospitalizations within the last year, no medications, not pregnant, and no significant joint pain. On the physical activity readiness questionnaire, the client answered no to all the following questions, and this means the client can gradually start becoming much more physically active. The client scored a 77 on the Fantastic Lifestyle questionnaire, which is part of the very good category. The client signed the informed consent acknowledging the purpose, process, and risks and benefits in participating in physical assessment. The client's current activity. The client participates in softball training once per week, plays softball once a week, and occasionally does light cardio. The client currently lifts weights in the gym, but is looking for a more structured program to increase her 1-rep max, and to see improvement in her strength, which her current training is not giving her. The client's activities of daily living include attending uni for a full course, and work part-time, with prolonged standing, walking, and sitting periods. Goals. Exercise prescription is primarily designed to meet the needs of the individual's health and physical fitness goals. The client's health goal is to lose excess fat. Therefore, we will measure the client's body composition and design a program to decrease fat mass and build lean muscle mass. The client's behavior goal is to adhere to the exercise program. Therefore, we will assess the client's training regularly and show her when improvement has been made by the results to keep her adhering to the program. And finally, her exercise goal is to improve muscular strength in arms and legs for playing softball by increasing 1 repetition max, and to run a 5-kilometer run in less than 30 minutes. Therefore, to increase bench press, squat, and deadlift by 1 repetition max, we will introduce resistance training and introduce more cardiovascular fitness into her schedule to Various research on female softball players has come up with the following needs analysis. Research by Plummer et al. Identified that for female catchers, there is a need to give strengthening exercises for the entire lumbopelvic hip complex, and a need for coordinating trunk and upper extremity exercises to help prevent catchers from altered kinetic chain sequencing. Overuse injuries are also very common in softball players because of the repetitive forces during throwing action. According to Myers et al., listed above are the most commonly found upper extremity injuries that account for 23 to 47% of injuries in female fast-pitch players. As well, 36% and 22% of lower leg injuries are specific to the knee and ankle regions, respectively. Based on the pre-screening test, this client is fit to begin a prescribed exercise program. From the literature, recommendations include closed kinetic chain exercises that involve multi-joint movements, as well as upper body exercises to prevent shoulder joint complex injuries, and lower body exercises to strengthen the gluteals for control during throwing motion. The client exercise program should meet these recommendations. The action plan includes pre- and post-exercise testing to monitor the client and ensure her goals of increasing her 1 repetition max during bench press, deadlift, and squat, and 5K run time are met.